Thanks for joining. We're going to get started now. Just a reminder, we have approximately 30 minutes, one question, one follow-up. We have Dr. Moore today, so I'll turn it over to him for some brief remarks.
Good afternoon. Today, there are 127 new cases of COVID-19 in Ontario. There are 145 people in hospital, 149 in intensive care due to COVID-related critical illness, and I'm sorry to report that there have been 2 more deaths of COVID-19. A total of 13,586 tests were processed yesterday with a percent positivity of 0.9%. So overall, the numbers continue to trend in the right direction. For the vaccine data, with respect to COVID-19 vaccines, local public health agencies, pharmacists, primary care physicians, paramedics across the province have now been administering more than 18.3 million doses since the start of the rollout. 79% of Ontarians aged 12 and over have received 1 dose, and close to 62% have received 2 doses. That means that almost 8 out of 10 eligible Ontarians made the important decision to protect themselves, their family, their community, their schools, colleges, and universities and workplaces with at least 1 dose of the vaccine. Thank you for making that decision, but your job's not over yet. Please get that second shot to make sure that your loved ones are as protected as possible against COVID-19, especially the Delta variant, which needs 2 doses for maximum protection. Around 2.2 million Ontarians still need their second doses. Please get them soon. It leaves around 2 in 10 eligible Ontarians who have not received a single dose at a time when we are seeing our vaccination rates slowing and the risk of Delta increasing across the globe. This means that over 4 million people in Ontario remain unvaccinated. That figure includes individuals who can't get the shot yet, so those that are younger, 11 and under. And that leaves around 2.5 million Ontarians who are eligible to get the vaccine but have not done so yet. This is despite having great capacity across Ontario, a steady supply of all mRNA vaccines, including 1.2 million doses of Pfizer this week, and it's anticipated we'll receive another 1.5 million doses of Pfizer next week in Ontario. I know there are still many individuals who might be undecided or are not sure of the benefits of getting vaccinated. So let me take this opportunity to tell you why I encourage every single Ontarian to go out and get the shot as soon as possible. The vaccine is very good at preventing new infections. It is excellent at keeping people out of the hospital, and our goal has always been to protect our healthcare system and reduce morbidity and mortality. The vaccine's also safe and effective. According to data from Public Health Ontario for the month of June, the risk of COVID-19 was 4.7 times higher in unvaccinated individuals compared to those fully vaccinated, and 3.4 times higher compared to those that are partially vaccinated. While the rate of hospitalization has been low in June, it is still 3 times higher in unvaccinated individuals compared to those who had received at least 1 dose. As a result of the direct effects of Ontario's vaccination program, Public Health Ontario has estimated that 30,395 cases amongst individuals 18 and over have been prevented to date, which is remarkable. A further 2,463 hospitalizations or deaths have been prevented amongst individuals 70 years of age and older. The benefits are clear that getting vaccinated means you're less likely to get infected or suffer the severe outcomes of COVID-19. Because no vaccine is 100% protective, if you do get infected, you are still less likely to get really sick if you're vaccinated. And also, time is of the essence. There are only 6 weeks to go before September, when school is set to resume and the cooler weather will begin driving us indoors. We'll be in closed spaces with closer faces in crowded spaces. So our risk will be going up very shortly. For those who are not vaccinated and may have a chronic illness or who are older, you need that 6 weeks to build immunity. You need your first injection, wait 28 days, get your second injection, and then your immunity builds around 2 weeks after that. So if you look at the timing, if you get immunized now, starting, you'll be protected for when we anticipate a rise in cases in September. To our younger Ontarians, it's not long now before you head back to school, college, or university. We want that return to the classroom to be safe. We want you to have and be able to participate in social activities and sports. And as a result, we ask you to get immunized as well. A key measure in our move out of Step 3 on the reopening of Ontario are our vaccination rates. We aim to reach 80% of Ontarians with 1 dose and 75% with 2 doses of a vaccine. It's disconcerting to me to see the impact that the Delta variant has had in the southern United States and in the unvaccinated populations in the UK. And any potential surge in cases in Ontario will most likely be in those that are unvaccinated or partially vaccinated. We have time to avoid that reality. So please consider getting your shot now. And if you have an appointment scheduled for later in the summer or early fall, you can rebook for an earlier date to ensure you receive your maximum protection as soon as possible. We just need 28 days separating between the doses. So please consider calling your health unit, going on their booking system, or visiting ontario.ca and rebooking your appointment for that 28-day separation. To reach as many Ontarians as possible, we are taking a multifaceted approach to provide vaccine. We continue to work with all of our partners, local public health agencies, community organizations, primary care providers, pharmacists, and others to address barriers and ensure everyone who wants the vaccine can receive it. More and more pharmacists and public health units are offering walk-in clinics, and our primary care providers are playing an even larger role as we continue to vaccinate harder-to-reach patients and combat hesitancy. In many cases, your trusted primary care provider will have had a long-time relationship with you and can provide the confidence in getting vaccinated that you may need. If you get a call from your doctor's office about when they can help schedule you for a COVID-19 vaccination, please take the time to speak with them about any concerns or questions you may have. A recent survey of the Ontario Medical Association of their physicians found that 98% of the respondents have already received both doses of a COVID vaccine. This is a resounding vote of confidence from our medical professionals about the benefits of vaccine. To Ontarians who have already received their vaccine and their 2 doses, thank you so much. To those who have yet to receive their vaccine or their second dose, now is the time to step up and get the shot so that you can build your immunity before public health measures are further loosened and before the cooler weather arrives in September. There is an ample supply of both mRNA vaccines, including Pfizer and Moderna. And our healthcare providers are ready and willing and keen to provide you with your shot. We know there will be an increase in cases as we reopen the economy and we move into the fall. But by increasing immunization rates to the highest level possible, we best protect ourselves, our community, our health system, and our economy. So I am reminding Ontarians that this is an ongoing call for arms. Time is of the essence. We need to build a wall of immunity around every community in Ontario, and we're all in this together. The highest immunization rate we can achieve will protect all of us. There is a risk we see in a rise in cases amongst the unvaccinated and partially vaccinated, so we must encourage everyone to get immunized now. Now I'm happy to take any questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
From Chris Rashew, the Toronto Star. Oh, hi there. Hi, Dr. Moore. Thanks for taking my questions. I was just wondering about concerns about the slowdown in vaccine uptake. If this continues, is it maybe time to consider some sort of proof of vaccination or other incentives, as we see elsewhere, to get these numbers up?
Well, good question. I think we'll follow the data. I am monitoring this on a daily basis, as well as every member of the task force, and I'm sure all public health units are monitoring their rates on an ongoing basis. They've started to try to have multimodal methods. I've heard of some health units have buses going to beaches, working at malls, trying to get the message out to younger population that has a lower immunization rate. So I think we have time yet to try to use as many means as possible before we have to move to incentives and or any other policy approach.
Follow up?
Thank you. And I'm just wondering, with regards to back to school, where exactly you are right now in planning for the fall and what it's going to look like and what kind of things you're considering for schools.
So we've just received the science tables feedback and recommendations for the fall. That has been given to the Minister of Education and his team at the ministry, and we provide ongoing advice to them. I do believe that they are reviewing it and all of its recommendations and will be incorporating that into their fall plan. We continue to provide advice to the minister. As my predecessor, Dr. Williams, has said, we want schools to be fully open, the first to open and the last to close, and I've confirmed that with all of my colleagues, fellow medical officers of health across Ontario. That is our aim and our goal, to get the schools open as fully as possible. We will be able to achieve that as well safely with the highest immunization rate going into September. So another call for all students 12 to 17 to get immunized as soon as possible so we can have a safe opening of all of our schools.
Next question.
From Randy Rath with CHTV.
Yeah, hi, doctor. We seem to have a situation where most people have been vaccinated, and it's really hard. It's very unlikely that they're going to contract COVID, and even if they do, they're not going to end up in the hospital. But there still seems to be a culture of fear around COVID, that vaccinated people have to mask and separate themselves from other people. When will we be able to drop that culture of fear? When will how many people need to be vaccinated before we can get back to normal and not masking and not having to fear the person standing next to us?
Well, great question. Certainly, I'd love Ontario to have one of the highest vaccination rates in the world. The modeling, though, tells us that once we're at around 90% of the population immunized, eligible population immunized, that the risk of Delta, which is much more infectious than the other strains, will be less for us. I am concerned monitoring Delta's activity across the southern United States, across the UK and elsewhere, of its potential rise in the fall, and it would rise and spread mainly in unvaccinated groups. So as I said earlier, we have around 4 million plus individuals who haven't taken benefit of the vaccine to date. 1.5 million at least can't get vaccinated because of their age. So the call today was really for that 2.4 million individuals to come forward and get immunized. The highest rate we have will allow our society to return to a more normal state, a post-pandemic era, with less fear, because there'll be less risk of the virus spreading in our communities, spreading to vulnerable populations, spreading in long-term care facilities, or overwhelming our health system. So to me, the way we combat fear is by having the best level of protection and prevention of COVID-19 in our communities, and then people will see that the virus just can't spread when we have high immunization rates. It can't interfere with our children returning to school or our colleges or universities or in our workplace, and won't cause harm in our hospital system by backing up our intensive care units. So to me, as a public health physician, it's all about prevention, prevention, prevention. We can either get immunized or we have to continue to have to fight outbreaks in our community amongst mostly now going to be unvaccinated or vulnerable populations. My preference, 100 times in a row, will always be to have the maximum immunization rate so that we can get our society back to as normal as can be and reduce the fear of this virus.
Follow-up?
What risk are faced? What risks do unvaccinated people that choose not to get vaccinated, pose to vaccinated people?
So it all depends on the proportion. If we remain at around 20% of the population unvaccinated, we won't build a community immunity, and you'll get breakthrough infections in those individuals that are vaccinated, because not all individuals, especially those that are elderly or vulnerable or immune suppressed, and or are receiving dialysis, for example, will get full protection of the vaccine. So the higher the proportion of our population immunized, the less we'll have to worry about those vulnerable people getting COVID despite getting vaccinated. So that is the concern, that unvaccinated still pose a risk because we haven't built enough community immunity against the virus, and it would cause breakthrough infections. But I'm confident from the modeling that I've seen that if we can achieve a higher rate of infection heading into September, like in the high 80s, 90s, then the fear of this virus will diminish. Its ability to spread in our communities will diminish. Its ability to interfere with our life and lifestyles will diminish, and we can get back to normal. That's why the call is today, and has been for the last 3 times I've spoken, to get immunized. It's our way out of this pandemic.
Next question.
From John McGrath, GVO.
Good afternoon, Doctor. Last week, the Premier was asked about the possibility of bringing in some kind of provincial vaccine pass, a more rigorous proof of vaccination for people. He said it was a hard no, and he said that you agreed with him. I'm wondering if that's accurate. Would you say that you are not considering any kind of vaccine pass system for Ontario?
Well, that would be a government decision. It wouldn't be my decision. I only advise government. And anyone that wants their certificates of vaccination, you can download it to get your 2-dose documentation, and you can use that as validation that you have been vaccinated, if that's ever required. So that means of validating has always been present, and it's downloadable through the Ontario.ca website. I've done the same and printed them out to have them if I'm ever asked, either in a workplace and or if I'm traveling. The goal for us is to have the highest level of immunization possible, and I absolutely want to do that as best we can through a voluntary means. Ontarians have been wonderful. 8 out of 10 eligible Ontarians have stepped up and gotten their first doses, and we're close to having that same number second doses. Now that we have Delta as our main threat internationally, and the highest it's over 80% of the samples that we've detected in Ontario on a daily basis now being Delta. We need a slightly higher percentage than what we set as a previous goal. I do believe through the hard work of our local public health agencies, with our family physicians, with our pharmacists, we can achieve it. We just have to draw the attention to Ontarians that this is our way out. This is our ticket to getting to a post-pandemic world where we don't have to, as the previous reporter had asked, live in fear, and we can get on with our lives in a much safer environment, and potentially without any public health measures if we can keep the rate of immunization as high as that.
Follow-up?
But you have said, even just today, that you'd like to get us to 90% in order to stave off Delta. Based on where we are now and the current sort of pace of things, it seems really unlikely that we're going to get there absent more either coercive measures or incentives or something. Is there, you talked about following the data earlier. I mean, could you imagine a scenario in which you ring up the Premier one day and say, like, this isn't working, we're not going to get to where we need to be, we need to try something else, and that could be a vaccine pass or incentives or something new?
Yeah, so I've heard of multiple different immunizers starting to review the possibility for incentives, and I think that's reasonable in this environment as we talk about it's the last mile or last kilometer that we're trying to really reach protection at the highest level for Ontarians. And I think we'll look at all possibilities of trying to achieve that, whether it's through different partners in immunization incentivizing and or ensuring that the accessibility and the availability of immunization increases. I think we can still do a lot of work before we have to have any type of mandatory passport and or mandate of vaccination. Just in follow-up, though, I would suggest that as a regulated health professional like myself, I'm so proud of my colleagues, physicians that have on the survey achieved 98%. I do think it's the responsibility and obligation of any health professional to be immunized. If you're taking care of patients, that you should get the vaccine. This is a highly safe, highly effective vaccine that can reduce the risk of harm in a hospital or clinic setting and reduce the risk of transmission. So I do call on any healthcare professional as a professional to exercise their judgment and get immunized as soon as possible.
Last question.
From Allison Jones with the Canadian Press.
Hi, Dr. Moore. Following up on the science tables report, there's been a lot of chatter about the masking recommendations. As I read it, it was suggesting that if the risk is low, masking should be permissive in schools, but also follow local public health guidance. I'm wondering if there's a specific level that you feel is low enough that kids could safely go unmasked in schools.
So that's a good question. I have read that. It was just released yesterday. So in a very low risk setting, so that would be in a region with, I would think, less than 10 per 100,000 cases per week. That would be a permissive approach. And they also recommended regional approaches to the provision of public health advice to school boards. That may be difficult to implement, and it may be that we have a very cautious start in September and then monitor the situation, because I don't know if it will achieve the that high community immunity that we need in September. So that's a decision I don't believe has been made as of yet. I do like the data-driven decision making and based on risk. And as you move to a moderate or severe risk, I do believe the science table recommended masking in place to prevent transmission in the school setting, and to me that makes sense. It's all about how we anticipate September turning out in Ontario and monitoring the data as we move to that date. We still have 6 to 7 weeks to monitor that very, very closely and make appropriate decisions.
Follow up, and this is the last question.
Then you had mentioned that you expect cases to start rising in September. Does that mean that you think that we, at this point, it's looking like we will not be at a level for September where you would feel comfortable with kids going unmasked in schools?
I would follow the data. I do like a regional approach that the science table has provided because we've seen across Ontario that the rates of illness can be quite variable, and that Delta can suddenly surge like it has in Grey Bruce and Waterloo or Porcupine and North Bay, and then percolate in those communities. So in those communities, I would probably be, if I was the medical officer of health, advising that masks be worn if school was to return, and Delta it persists in those communities because it can spread so quickly from one person to 6 to 36, etc. Very aggressive transmission. So I think we'll make a data-driven decision-making. We'll follow the rates of illness across Ontario. We're meeting with the medical officers of health from across Ontario to understand what data they'll have at their fingertips to be able to make these decisions, and we're certainly going to be working very closely with the Ministry of Education and their team for the fall opening.
Thanks, everyone.